Just like humans, we're going to put an endotracheal tube down the throat. Hey guys, my name's Dan, I'm a veterinarian, and today I'm going to go over what to expect with regards to surgery for your dog or your kitty. Unfortunately, most of us have to have our pet, our dog or our cat or whatever you have as a pet, may have to go under anesthesia at some point in their lives. It may be for a routine procedure like a spay or a neuter. It may be for something more serious, like let's say they ate a corn cob or a toy that needs to be removed. Or they got a bladder stone, we need to have surgery to remove the stone. No matter what, surgery can be scary. Anesthesia in the veterinary world has grown leaps and bounds over the years. Veterinarians provide amazing service to keep the doggy or the kitty as safe as possible during the anesthesia. So things that may be provided, and I would highly encourage the pet owner, you guys, to double check with your veterinarian before having any procedure done. Just like humans, we're going to put an endotracheal tube down the throat, and we're going to hook it up to general anesthesia, which provides oxygen and anesthesia gas so we can sleep through the procedure. Once that's all hooked up, we will provide IV or intravenous fluids to provide a healthy fluid delivery so the dog stays hydrated during surgery. Also, we'll have a lot of things to monitor to make sure that we're healthy and stable through the entire process. This may not include all of these, but it should include a lot of these things when monitoring. A pulse ox or pulse oximeter to make sure the oxygen saturation is good with regards to the blood. A blood pressure to make sure that our blood pressure is not dropping or getting too high during the procedure. As well, there may be a little beeper or monitor that measures how much carbon dioxide is being breathed out by the pet. So not only can we monitor oxygen going in, but we can monitor expiration of carbon dioxide. If a procedure goes really long, or if we have a small doggy or kitty cat, we're worried about temperature. We want to make sure they maintain a good temperature. So a thermometer is as well placed to make sure that we maintain a good temperature, not getting too cold especially, and in some rare cases, not too hot. And a lot of you may be familiar with an ECG. Basically, we put little clamps, right, on the elbows and the knees and the chest, and that allows us to get an ECG, right? So it goes beep, 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 and we can see the PQRS waves. By seeing that, we know the heart is beating appropriately. There's no, atrioventricular blocks, so there's no break in the heartbeat. And we can also tell that there's no premature ventricular abnormal contractions. By having all of these things monitoring for me, I can make sure the doggy is stable and healthy during the surgical procedure. And if the monitoring equipment gets abnormal, they will troubleshoot with their licensed technician who's going to be their hands. The licensed veterinary technician will adjust the oxygen, the gas, they'll manage any of the monitoring equipment, they'll give any IV injections they need to give, or increase fluid rates to make sure the doggy or the kitty is stable and healthy during the procedure. Once the doggy or kitty has completely recovered, we go ahead and pull the endotracheal tube, and we call mom and dad and tell them we did awesome, and they can pick up soon. Hope this was helpful, guys. Of course, anesthesia in doggies and kitties is used for anything from major surgeries to dental procedures. Veterinarians use a lot of general anesthesia.